Hello everyone, I'm Dr. Achonu. I'm the clinical researcher for the Brain and Body Study Foundation for the Vitamin D study, Massey participants in Lagos. It was a privilege to be one of the researchers to coordinate the study in Massey. It was initially challenging, but at some point I got to flow the study. The participants were unique, children who are in pain, but at some point in their life they get accustomed to their medical condition, and this has allowed them to be able to adapt to this form of pathology. But I discovered also that there are some key factors that helped in the management of these children. Aside from the medication, there's the emotional aspect, there's the social aspect, and there's also the medical aspect. The emotional aspect is in the sense that if the child feels that he owes it a responsibility towards the mother or the father, then they tend to remind their parents or their caregivers to take their medication or to pinpoint the point at which the crisis is about to begin, especially for the painful crisis. Then the social aspect is the family support, the environmental background, the care, hygiene, as well as the provision of basic needs, water, food, healthy food, and prompt care, ensuring that the appointments are met at when due. Then the medical condition aspect, there are some children that were diagnosed on time, they do much better. I discovered that they did much better than those that were detected late. Like for a child that was diagnosed at the age of 2 or less than 18 months and have been on their medications, they tend to have less complications or complaints like ear pain or complaint of sight issues. But the ones that were detected at the age of 5, 6, 7, they also had complaints. But in all, the vitamin D helped the participants that were very compliant. And for the ones that were not so compliant, that's where the social aspect comes in. The mothers were not there at all times. They would give excuses like, okay, they were not at home, they had to drop the child with a caregiver and they could not monitor. Hydration was not ensured as at when due. They were not taking sufficient water, and these were the things affecting the frequency of crisis, as well as the blood parameters to be high for the WBC and the red blood cell count to reduce from what it used to be at some point in time. It's a very, very interesting study, one in which you see even the output and analyze each patient per visit. We had a total of 4 visits, and in all we had about 80% progression with good outcome, both for the participants and for the control. And I thank Brain and Body Study Foundation for this opportunity. Thank you.